All right. Y'all, I promise I haven't had any coffee. I've had a little bit of Starbucks. But I'm super excited for today's conversation. If you don't know who I am, I'm sure you do because you are connected to one of our pages. My name is Cameo King. You can see it right there in the screen. Cameo King. I am the host and the owner and the founder of the Good Girl Podcast. The Good Girl Podcast is a podcast where we are redefining what it means to be good through uncomfortable truths. I call those uncomfortable truths confessions. So every week, every Wednesday, we have someone on sharing a confession. The goal of sharing that confession is to free folks, to heal folks, to get us out of this bondage, because we very much live in a society where we are taught that success comes through performance, success comes from abiding and following a set of rules versus being who you are and that being the key to your success. There are also things that very much sit with us and sit in our spirit that if we mess up, therefore, we aren't worthy of something, or that cancels out what our calling, or that cancels out, whatever success we could have. And so this show is the antidote, right? And I kind of jokingly called it Good Girl. To attract some of us that think we good girls, right? Because when I started this, I was convicted. God was like, "Oh, you think you good? Let me show you your ugly soul." God ain't say it like that, but definitely some things revealed to me about me, and continuing to reveal those things about me. And so I said every Wednesday. And so right now we are technically on a break. Our podcast will resume in February. We have some great confessions coming up. And just a reminder, we're doing something different this year. You should follow us on TikTok, Instagram, and on Facebook if you aren't already. But we'll also begin accepting anonymous confessions, because I know it's sometimes difficult, right, for people to share that raw truth about themselves, that uncomfortable truth about themselves. But I still think it's important to have conversations around it where we own our stuff and we talk about walking through that process of healing. So we are accepting confessions, anonymous confessions, but you got to follow the link on our website, goodgirlpodcast.com, or on Instagram, and it says confess. So what I'm going to do really quickly is talk about what we're going to chat about today. And I'm not going to be before you long, I promise. I know some church folks say that. I'm a part of that community. I'm gonna stick to it. So if you haven't already, please share. But we're talking about COVID today, COVID-19. We are now 3 years into this pandemic, and I don't think any of us could have really thought that we would be where we are today. Still wearing masks, hospitalization still up, capacity. I think I heard today that one hospital was at 26% in terms of capacity. I think we thought we would know more, at least from the public side of things. But I want to have this conversation today because I think a lot of us feel like our hands are tied. A lot of us feels like some of us are just tired of it. And we want some direction. I think last week or the week before last, there was a lot of jokes, a lot of memes about the CDC's response. And it was I think it was a couple that were funny. One, the CDC was like, if you don't give a, we don't give a, I don't want to curse on here. I don't want to curse on here. But it was some that was pretty funny. So for this, I want to bring on someone that is familiar with the podcast, that has worked not only with the public, being hands-on, being on the ground, but also understands the policies, understands the science, understands people when it comes to this vaccine, when it comes to the pandemic. And it is none other than Dr. Shoyinka. I'm going to bring her in right now.
Hey.
Hi.
Hello. Hi, how are you? Hello, everybody.
I am so excited to have you here. If you don't know Dr. Shoyinka, she is the medical director at the Ingham County Health Department, and she also has a background in infectious diseases. And so glad to have you. You're always a delight. You always come with a lot of information. I remember our last conversation, it was around COVID, but it was prior to the holidays about what was happening, what was going on, what people should do if they still wanted to be around their families. And so
Right.
thank you. Thank you for that.
Oh, thank you for having me, and thank you for listening to what we have to say. I know a lot of people aren't really listening, or they're kind of tired because it sounds like to some extent the public health community. I heard you talking about, the memes about the CDC. I saw some of them. Yes, they were funny. So I agree. I agree.
Somebody just commented. One of them was like, "Do you, fam? I'm tired of y'all. Do you? Do you?"
I know. Listen. And I
um,
am not, yeah, I don't blame anyone. So yeah, it's been an interesting couple of years. And we're going, like you said, we're going on number 3, which is like, seriously, um, they should be done by now. Like,
yeah,
I should be able to ditch my mask and
yeah. And I
get
and
on
I
with
and I must say that it is comforting, just being honest,
it.
to hear the sincerity and just how genuine you are. Not just in your role as a medical director, but as a human that's experiencing this as well.
Oh yeah,
Um,
we're all tired. So I'm sure, yeah, I'm sure Rachel Walensky, the CDC director, is tired too. But we can't stop. We're going to keep doing what we have to do, with the amount of knowledge that we have, to try and make the best decisions per time, which sometimes does not make sense, and sometimes those things change like really, really quickly. Some of those decisions, you weigh science, and then you weigh, economy, and you weigh, other things together, and then you have to find some middle ground. You weigh human behavior, and sometimes for everybody looking from outside in, it's like, what on earth are you doing? Don't let me swear here, but yeah, what the, yeah.
yeah.
So.
So I think one of the larger questions is this the beginning of the end? Do you know if this is the beginning of the end?
So I'll say I don't know. I can't categorically say that. Um, I will say that it is comforting to see the way Omicron has kind of gone in terms of the severity of illness that we've seen over time with this new variant. It kind of follows the way viruses kind of progress, like new viruses progress. Like, it's like a really serious one causes serious infection. And over time, as it evolves, the effect of it either, because there's a lot of it and it's become endemic and everybody has kind of gotten it. So there, we all have some level of immunity either through vaccination or through natural infection, depending on what infection we're talking about. And so with time, the severity of it gets, it reduces. And so I find that comforting in this space here, where we are at right now. We're also seeing that, with the way Omicron came in and, became like, I don't know about you, Camille, but I feel like everybody and their brother and their sister, all the people who didn't have it before, like everybody I turn to now is like, oh, I have COVID. Like, compared to before, where it's like, okay, I'm trying to be careful, whatever. We're all out in the community more. We just finished the holidays and everything, but I feel like, yes, we knew that this new variant was going to be more transmissible. They were saying it since like middle December, but it truly was like, it just spread like, it almost didn't matter what you were doing, whether you were wearing a mask or not. Now we're talking about, encouraging people to wear well-fitted, multi-layered masks as opposed to just your regular cloth mask that might be flimsy. Like, really pay attention to what you're wearing. And that's because, just a regular mask apparently wasn't necessarily working. So I say all that to say, I think I just started rambling, but I say all that to say that that might be an indication of improvement. The other thing is that, we've had a vaccine now for over a year. We have, within the United States, we have over 50%, well over, like over 60% of people who are vaccinated, already. when you think about Ingham County, where we have over 70% of people who have at least received one vaccine, which is great. I mean, that's kind of where we were going, right? That magic number was 70. When we get 70% of people, then, that would confer some level of herd immunity,
Mhm.
And so all of those things, putting all of that together, um, gives me some level of comfort that yes, we're getting to some place where we're getting a better handle of this. I mean, think about 2020, right?
Yeah.
This time 2020, we didn't know. We were just hearing like, oh, there's some stuff happening in China. Not everybody knew about it. By March, April, we were all shut down. And, it was like, what is going to happen? Is this like the apocalypse or whatever? 2021, this time 2021 was also pretty rough. There was really no Christmas. We just had this big surge. People were super careful. But, we've kind of moved a little bit. I don't know about you, but I did a little more Christmas than I did last year. You
Yeah.
know what I mean?
Mhm.
And so all of those things put together, the mere fact that we could all move around and people are getting COVID. And I don't know also about you, but the people that I know that did get COVID, vaccinated people for the most part, and even unvaccinated, the severity of illness is like, it's not everybody who landed in the hospital. The people who landed in the hospital came out earlier. It's not like, oh my God, they're on the vent. That's not to say that that is not happening at all,
Right.
right? But the numbers are less. Even in the hospital, as we're talking about, people being stressed, the hospitals being stressed and at capacity, the level of severity of illness is not as high as what we saw in 2020. That gives me comfort. And so even like I said, yeah, the infections that we're getting, even the numbers, if it was the rate at which people were getting infected, that we were all getting sick and ending up in the hospital, then it would be utter chaos. So
Yeah.
that's kind of the way I look at it.
Yeah, it's a couple things that you said, and I also want to encourage, if you're watching or if you're sharing, we can also answer any questions that you want to put in the chat. And I know one person put a question in the chat in response to you saying like it's promising, based on what you know now, which could change tomorrow, which could change in a week.
Yeah.
But I think this is what this question alluded to. It said, but could things go the other way? So could the next variant be 10 times worse than Omicron?
So, you never say never. But like I said, remember I talked about this this the way viruses kind of evolve over time, the way they, the same virus kind of changes over time and mutates. The expectation is that it should, it shouldn't go the other way. That's not to say that it can't. One of the reasons why it could get bad is where, if we have in pockets where there are a lot of people who don't have immunity to the virus, and there are a lot of them getting infected, and then there's a lot of, interaction with the virus and then mutation. That's where that could, possibly precipitate something. And when I talk about things being better, I'm talking primarily, in the United States, in countries where we've had a lot of vaccine. The problem could really be if we do all of this in a silo, and we're just talking about the United States, but there are many countries where less than, I don't know, 5% have been vaccinated, right?
Mm.
And we're still traveling and doing things. And, we, world round, we need to do a better job in making sure that everyone worldwide is vaccinated, because those are where those things can happen. Just like those pockets exist here in the US, but those are the kind of things that could precipitate a variant that is not as mild as what we're seeing. But because we're all getting, a lot of people have gotten COVID, including me, which I thought I had dodged the bullet for a while. But I had um, a really mild course. And so the more people that have it, the more people that have some level, some level of exposure, it becomes endemic, where it's not a big deal. And the virus kind of almost doesn't have a place to go to become
Mm.
more, to do more, so to speak. So it's hard to say, but based on what we're seeing, the hope is that it gets better. Now, how soon is that better? And I know you want to say something, but let me, before I forget,
Go ahead.
before we get to any kind of like super better, like, oh, are we ever going to get back to normal? No, I'll say, like, not like pre-COVID. There's still going to be some, we're probably always going to have, maybe the COVID vaccine is going to be something that we do like the flu, yet to be seen. Is COVID going to go away completely and it will never be an infection? No. But is it going to cause as much chaos as it has in the last 2 years? No. Now, what are we looking at in terms of a timeline? I don't have a magic ball, but I think that through 2022, we're still going to be, kind of going up and down. It might get better, summer as the weather warms up, things might be a little better. I think later in the year might be where we'll be able to see, like, are we out of this? And this is just me, looking at what we've seen over time. So I know that wasn't a straightforward answer, but
I think not having a straightforward answer, I think we really want to look at things in a black and white manner in terms of like this, they definitely said it will be over here. So you can start planning, so you can kind of get a sense of relief. But the truth is, nothing in this world is black and white, let alone this virus.
The other thing I did want to mention about the good stuff that we've seen, though, is that when this started in 2020, even all of us in the medical community, like in the hospitals, we didn't even know how to treat this disease, this infection properly. There was a lot of, change in data, like, oh, steroids work, steroids don't, this is the kind of people who are in the ICU, this is how they should be treated precisely. This medication works, this didn't. Now we have options. So we have, I don't know if you've heard of it, but we have monoclonal antibodies that we use, that people use before they even get into the hospital. So if you have mild to moderate infection and you're at high risk, then you can get monoclonal antibodies to prevent you from getting severely ill. And then just recently, in the last couple of weeks or so, the FDA just approved pills. So there are 2 pills that are going to be available. I know they've started distributing them in pharmacies. Meyer seems to be the main distributor here in Michigan. So if anybody does have infection, it's still being restricted by risk and age. Usually, I think most people who are elderly and are immunocompromised are the ones who qualify for it right now. But my point is that we have some treatment. One of those pills has effectiveness rate of about almost 90%, about 87, somewhere in there. The other one isn't as great, but the monoclonal antibodies also work really well. So even if you do get COVID, before it was like, oh my God, there's COVID and like there's no hope. There's nothing to treat me if things get bad. But there are options, and all of that is the medical community working like crazy to find answers. And there's more in the pipeline. So again, in terms of hope, in terms of things getting better, those are all the indications, so that even if something new comes out, a new variant, whatever, there's treatment for it to some extent.
And I think it's important to say a couple things, but one, I think some of this, and I understand why you're hesitant, but when we have hope, I think we also relax, right? Because I know if something happens to me, then I'm not as self-aware when I go into the store. I'm not as self-aware, coming home and washing my hands or stripping, coat, clothes, whatever it is.
Right.
Because you have this in the back of your head. And I really believe that's where we got at some point. And I think it's just because we got very comfortable. And I also think because there are some miscommunication or some misinformation out there about what the vaccine really did, like that the vaccine prevented you from getting COVID. But we know that's not true. What it did is it minimized
your symptoms.
Right. So you wouldn't be hospitalized,
right,
or so you wouldn't die, essentially,
right.
When you got it. And also, other thing I want to point out, I love how you very much put this, gave us a global perspective. That while the United States could be, 75% vaccinated, 60% vaccinated, you have to understand there is a chance that this virus could come back and very much do what it was, I don't want to say designed to do, but do what it does, whether it's create another variant, come back stronger, because there are pockets in the world, there are pockets in the US where it's enough people who are not vaccinated,
Right.
who can't get vaccinated for whatever reason, um, that could create a community where this happens
Right.
again. And so,
Right.
not to put the US as though we are at the center of
Yeah.
being very self-centered, you know.
Yeah. Yeah, I think worldwide something better needs to be done in terms of equitable distribution of resources that are critical and that matter to every single person on the globe. And I don't think we've been able to do that in this case. I mean, Omicron did not start in the US, but
Mhm.
within 2 weeks, it was everywhere.
Yeah, yeah.
Like middle of December around Christmas, I was like, no, it's not the dominant strain. Delta is still around. And by January 5th, it's like, yep, it's here and it's overtaken Delta. And, so that's an example because it didn't start here. At least it wasn't initially identified here, but we
Yeah.
all travel.
I think one of the concerns, and this is more, I'll say, psychosocial, when it comes to solutions.
Hmm.
And I just want to acknowledge it in this conversation in terms of those who decided not to get vaccinated for whatever reason. And I'm not creating a polarizing conversation,
Hmm.
but I think at the heart of it, because I've been racking my brain, like, why wouldn't you get something that could help your family, that could help the community?
Yeah.
But I think at the heart of it is we are human beings who have control over our bodies, right? We are inherently like autonomous individuals, right? Like
I
if I
love the
want
way
to
you put
eat,
that.
10 pounds of ice cream, and so I can do that because it's my body. I own it. And I think the idea of an outside entity telling you what to do and what you have to do is at the center of some, not all, but some of the pushback when it
Yes.
comes to getting vaccinated.
You're right. Even a child, I mean, like, even a child, yes, you are a parent and you should be able to tell your child what to do. But, more recently, I guess most parents would know that one, you could threaten your child to say, get it done. Or you could give that child some level of autonomy and you're probably going to get more success, especially if it's like in the context of a tantrum or something they don't want to do. Like, okay, do you want red or do you want blue? But you have to take one of them. You have to take a pencil and you need to start working, do your homework, but I'll let you choose whether you can choose a yellow one or green one. So I mean, even that's like you said, it's innate, it's human nature. And I think that um the public health, the medical community, government, I think in the context of this pandemic, while we've been trying to wade through the information and make decisions on the fly and changing guidance and things like that, I think we've done a really bad job in communicating to the public as to what what how why the usefulness of the vaccine, why you should get it, why it's so important. I think we came out saying it's important, everybody should get it because as opposed to finding better ways. And now we have like vaccine mandates, and yes, I agree that it'll make a difference if everybody is vaccinated. Using those words to, like you said, makes people kick back and say, okay, why are you forcing me to do this? Is there something else behind this? And we all have issues, reasons why we may or may not trust, particularly in our communities. So it makes it harder. Like, and depending on what your background is, it's just you can't
Yeah,
move past it regardless of what So
yeah,
yeah, it's
yeah,
it's something that we need to do a better job at. But it doesn't take away the truth or the fact that, this will make a difference in our trajectory along the way. But yeah.
And if you're just joining us again, I'm talking with Dr. Shoyinka. She is a medical director at the Ingham County Health Department. We're having a conversation about COVID, about COVID-19, about what's next. We're 3 years into this, and it seems like, and I put an emphasis on seems like, we haven't made much progress. But based on where we are in this conversation, based on what has already been shared, we're actually a lot further along when it comes to what happens to an individual if you get COVID, in terms of the solutions, whether it is, and I'm going to butcher this word, Dr. Shoyinka, but I'll call it infusions. Can I just call it
Yeah.
infusions?
Well, yeah, but it doesn't necessarily. Yeah, you can say infusions. Let's just say infusions because that's what.
Okay. So I'm gonna say this. So if y'all go to the hospital, don't be like, well, Cameo said I could get an infusion. They're like, what are you talking about?
It's called monoclonal antibodies.
And so I'll just say antibodies, okay?
Yeah.
Antibodies.
So antibody infusion for COVID. Maybe that's one way to put it. And I will say that, just like you said, just like you're saying, if anybody does have COVID, because it's newer, not the access is kind of difficult. If you have it, make sure you ask your doctor about it, because sometimes the access is not always available. You might have to, give your doctor a little push, like, how do I get this order? Find, me some. And I would just say, if you go to the Ingham County website, on there's a little flyer about monoclonal antibodies and where it's available. Like I said, it's not as available right now, but those things change from week to week in terms of like production and things like that. And then there are other options. Like I said, the pills are also available. So make sure you're asking your doctor, like, do you know about this treatment? Can I get it? And then they can, assess you based on where you're at.
And so just a few more questions. And I just, again, want to remind those who are watching, if you have a question, pop it in the chat. We'll make sure that we will, be able to ask Dr. Shoyinka. And also remember, if you head to thegoodgirlpodcast.com, we did do a show prior to the holiday season that we went deep, I think, in terms of solutions, in terms of where people were and potentially where this virus was going. But again, things change so quickly with this. So be mindful at the time that you're listening to it and the information that we shared. The other piece that I think is important, while we're having this conversation, there are a limited amount of people that are watching this, right? And we also understand what's happening in the news. I think East Lansing High School, they had about a 50% attendance in terms of students, whether they were out sick or whether they didn't feel comfortable. I believe in New York, high school students staged a walkout in protest because of conditions for COVID, in terms of also the learning environment, that they wanted more resources. And so while it was the best of times and it was the worst of times, I'm not saying this is the best of times, but we're seeing improvements, but we're still seeing ripple effects from what has happened in the past. And so I set that up to say, what really can we do now as we move forward, whether it's families, whether it's caretakers? Is it still hunker down, wear your mask, get vaccinated? What is
it? Those measures that you mentioned that we've been talking about since the very beginning. Well, maybe not very beginning, but yeah, that we've been talking about for a while. Wearing a mask now, like I said earlier, I guess we were talking about that before we started Cameo, that mask wearing is really important now, especially in the context of the Omicron variant, because it's so transmissible, much more so than what we were seeing before. Like we were saying, everybody we know is getting it. And what we know is that cloth masks don't necessarily do a good job. So if you are wearing a mask that is cloth made, you want to make sure it's well fitted. You want to make sure that it has multiple layers. So you might even want to double up on your mask. One thing that I use a lot is the KN95. I just buy them on Amazon. And they have multiple layers. They're not what we use in the hospital, but it has a good filtration system. So mask wearing is still really important. Keeping our distance when necessary, and of course, for anyone who feels comfortable with it. I know there's a lot that goes into that conversation, but vaccinations are a really big tool in our toolkit. Now. But I do want to circle back to, you talking about the students in school and how that's affecting so many other things. One thing that COVID has taught us as a society is that we can do a lot of things. We can find other ways to do things, right? And so when we talk about students who don't have enough resources, or, it makes me think about the mental health, portion of what this has done to us and to our families and friends. So finding creative ways to connect in society is really important at this time. The weather is cold now. You might not be able to gather with as many people, but that's why we all have phones. Thank God this didn't happen in the 1990s, where we didn't have easy access to cell phones and we could all do Zoom and all of that. I was listening to a book the other day, and someone was talking about what happened in the 1990s when making a phone call on your cell phone cost 25 cents a minute. And I was like, oh my God, I remember that. So, thankfully we have our resources. We've got to get creative in order to figure out how to live our lives, and be healthy while we hopefully get to some better semblance of normal. But yeah, mask wearing is still a thing. Find pretty masks. The last I don't have one close by here. I just bought KN95s that have like flowers and nice patterns on it. It made me feel a little happier.
So. Oh, it does. Listen, if you want to, this is a shameless plug. Grit Glam and Guts, the nonprofit that serves girls. I have like a cute little flyer for the girls right here. We actually have masks on our website. So if you want to support, you will be supporting a great organization. Great. And you'll be being safe. And they're really cute. They have like sparkly lips on them. So
yeah.
They're for sale if you want to check that out. But I have a question specifically about masks. Someone asked this on Facebook, and I want to make sure my volume is down to make sure it doesn't echo. Let me see if I can do this quick enough. They were asking about masks, specifically like how long can they last, right? Hearing different suggestions on what to do so they wouldn't be as disposable, I guess. Like, can you wash them? Or I think someone suggested putting them in a paper bag for 3 days, and then someone suggested putting them in a microwave. So are they single use? Or
are you talking about the paper mask, like the surgical mask and the KN95s?
So here's a specific question.
So,
go ahead. Oh, it says I've read that you can decontaminate N95s and KN95s and reuse them up to 25 times. One article said put it in a brown paper bag for 3 days. Another said to microwave steam them. What is the best method to get the most use of these kinds of masks, or should I just discard after one use?
So definitely don't discard after one use. You're not, as long as you are, what I tell people is as long as it's not damaged or soiled, you can wear it, right? I have washed my KN95. Well, by mistake, it went into the washer with other stuff and it came out okay. Now, what does that do to the integrity of the mask? Like in terms of the infiltration, I don't know, but it seemed fine. And so it's probably at the same level of, a cloth mask or a couple of, 2-layered cloth mask or something. And I still, use it. If I'm going to like a crowded place or something, I probably would use a brand new one that I know the integrity is okay. I don't know about, microwaving and things like that, because again, it might mess up the integrity of the mask. So as long as it's not soiled, as long as it's not damaged, and as long as it's, like well fitted, I think you can continue to use it. The cloth masks we wash, you wash them to, reuse. Yes, in the workplace setting, we do encourage when we for people to just put it in a brown paper bag and leave it, for leave it even overnight, a couple of days, because the virus itself does not survive that long once it's outside like the human body. We did a lot of conversation about surfaces and hand hygiene early on in the pandemic, but in reality, if there's virus on my dining table right now, it's not going to survive more than, like a few hours out in the open. It's very fragile, so heat, air, just dry air is going to damage it unless it, gets into another host and like a moist surface, like our oral, our mouth and nose and that kind of thing.
Okay, and it's a couple more questions. Someone asked, is it true that we all will or have gotten COVID virus in some form or another?
I think that the one of the things that I don't know that we all will in some form or another. I'm not sure what that question meant, but the one of the things that we're looking at when I talked about hope early on is that COVID becomes endemic, where it's in society. A lot of people get it right now. We're at the highest level of transmission that we've ever had, where on the average we have over 30% of positive cases over every 7 days of all the tests that are done at any given period of time. 30% of them are positive, and that's pretty high. So yes, it sounds like if we keep going with this particular variant, there's going to be a high amount of transmission, and high numbers. Will every single person get it? I mean, that really depends on the individual. And if you've been in your house and you have not been out and you're not interacting, then the chances are much lower. But is this something that we think the numbers are going to go up? Yes, but we are getting to a place where we're peaking, though. Where particularly for this, as quickly as it kind of came in, it's going to peak, then it's going to start coming down. And models that we've seen for this virus are showing that by sometime early mid-February, the rates should be going down. That is the hope. Okay. So I hope I answered that question.
I think so. Because I think there's a theory out, not a theory, but I think also in terms of relaxing or in
terms of relaxing measures, I would say that the recommendations are still going to be around, for a while. But in terms of this variant and what we're seeing, because there's been such a big surge of it, just like the progression of viruses, that's what we're going to see.
I think too, the idea of getting comfortable with the idea that you're going to get COVID was a part of that question. Like, should I just accept the fact that I will eventually get COVID? Because I think that's an idea some people are toying
I think it matters. I don't think anyone should, relax measures. Though, yes, it makes sense to think of it that way. I think it really matters as to what that person's, what's going on with that person. What is your, do you have risk factors? Do you, are you at high risk of developing severe COVID? Are you vaccinated or not? Are you fully vaccinated? Did you just get, like one vaccine or two? Did you get boosted? All of those things may determine how concerned you should be overall. So I think about all those things before like relaxing at all.
Yeah. And so I'm going to wrap us up with this last question. I don't know how often we talk about this or even how often this is really in the news. I feel like you hear it sparingly, but the conversations around long haul COVID, that we really don't know, because how this virus decided to show up. We really don't know the long-term effects. So while I may not have had any symptoms today, or I never got tested because I never had any symptoms, but I was in fact COVID positive, what is going to happen to my body in 10 years? And also some people still recovering from long
Correct.
haul who
Mhm.
still
Oh
have
yeah.
brain fog or learning how to walk or whatever it is.
Yeah.
Is there any conversation, prognosis? And I know you talk about that there are things that are coming when it comes to if you get COVID, that there are improvements. But
Yeah.
what's the conversation around that?
With regards to long COVID in particular.
Yes.
I don't know that I don't know what the prognosis looks like over time. I think we might have talked about this in the last time that I was here. That the one thing I do know is that they're studying it. I mean, there are long haul COVID clinics where they are managing
Mhm.
people who have had COVID and are just long haulers like that to really get a better understanding of what the progression of illness will be. And I think that one of the things that we're seeing is that what that looks like is also, just like I said, really dependent on the individual to some extent. you know um we do know, however, I have seen data to support the fact that people who are vaccinated, just like it prevents severity of illness, are much less likely to have long haulers syndrome. I anecdotally, I don't know anybody who is vaccinated who got COVID who did have long haulers. So
Yeah.
that's one thing that we could talk about in terms of prognosis.
Yeah. All right. Well, Dr. Shoyinka, thank you so much for your time.
For
For
having me.
Yeah, for being on the Good Girl podcast, and also just for the work that you are doing in the community. I look forward to all of you medical professionals being able to finally breathe, hopefully. Um,
Someday.
yes, this year, because who knows what the next 5 years will hold. So thank you for being a part of this, and thank you for sharing.
Thank you. Thanks for having me. And everybody stay safe out there. Okay.
All
God bless.
right.
Bye.
Thank you so much. Bye bye.